So today we're going to go over a full face treatment on a very attractive patient. What is your age?
I'm 48.
48, and I think like all of us, she's felt a little tired, stressed, and exhausted from the pandemic. And today I want to do something to rejuvenate, and we're going to treat 3 zones of the face: upper, mid, and lower face. And this is such an important technique to master because literally we can do almost a liquid facelift for this patient by redistributing heaviness of her facial volumes and giving an upward liftive vector of support. We're going to take away the jowling. We're going to add definition to her jawline and lift laxity from the lower face. And one of my favorite treatments is lifting the brow by doing temporal lift with temporal filler. So I think that with the technology we have with fillers, we're able to do a lot these days. And patients, when they maintain and treat the upper, mid, and lower zones of the face, and you see them in sequence at least every 6 months, you're going to be able to have a really rejuvenated face that does not rush right to surgery. I'm a surgeon and I like facial plastic surgery, but I'm also a patient and I'm not in any rush to have a facelift myself. So I want to do things for patients that I would do for my own self with facial maintenance. So I'm going to map the zones of her face that we want to treat today. And step 1 is going to be mapping from her tragus of her nose all the way to her nasal ala. We're also going to treat the upper face, so I'm marking from the temple hollow, lateral acanthus, oral commissure of the mouth, all the way down to the chin. And open your jaw nice and wide for me. Okay, good. When she does that, we can see the upper border of the zygoma, temporal hollow, cheekbone, and close it. Turn right over here, bite down on your back teeth. We're going to show the sharp accentuation of where I want her mandible to be most accented. And so these are the zones that we're going to treat on her face: upper, mid, and lower. I'm going to start by doing a little touch of temple filler. That's going to be step 1. And step 2, we're going to treat lower face. Step 3, we'll come back and fix the mid-face here. Lastly, we'll do some neurotoxin because she has drooping and heaviness, the procerus muscles pulling down quite strongly in here. We'll lift that. We'll position her brows to have some support. And open your eyes for me. I want to treat lateral hooding with Botox brow lift. We're going to treat the orbicularis muscles and open up to have a more open, wide, pretty eye. I like to do some neurotoxin around the mouth corners to lift the depressor effect of the DAOs as well. I am going to start with a little touch of filler for her temples. So let's see. Opening your jaw nice and wide. We can see this temporal hollow, and close your mouth for me. And we can palpate and actually see the little curly cues of the temporal, superficial temporal artery as well as the vein. Palpation is critical here. Looking for the deepest recessed part of the temporal fossa is critical. Open your eyes for a moment, look straight ahead. What's most important in my view is determining what makes her eyes and face look prettiest. So I can give volume and lift and support by placing some filler here as well as here, and that's going to give the most opening to her lateral brow. So I keep in mind the anatomy, but I also keep in mind what vector of lift makes attractiveness increase the most. And for me, it's generally that point where we have maximal recession as well as the point that's going to give us the highest lift of the brow. I'm aspirating here for a good 4 or 5 seconds. My finger is on the superficial temporal artery and my thumb. And now I'm going to inject. And as I inject, I'm watching and making sure I see volume correction. And I'm also going to be sure to prevent filler from going inferiorly by placing my thumb below that. It's a fluid. It's going to go wherever the path of least resistance is. So if I put pressure here, the filler is going to stay up in the temple. I don't want it to go down below. So a small bolus of probably 0.3 cc's, typically about 0.3 cc's in each location. We're doing about half a syringe of filler on this temple today, and generally a temple requires much more than that. When we do facial fat transfer to temples, it can take 5 to 10 cc's to fill a temple. A temple is a large area, and you can estimate with your fingers, 2 finger breaths, about 2 syringes of filler. So I'd say in her case, 2 syringes over time should be gradually placed here. And we even start to need volume in the parietal aspect of the scalp. So I think that's such a nice, interesting treatment to treat circumferentially around the face because we lose volume peripherally as well. This feels like a funny crackle noise for patients, and instantly she's going to get some nice improved open eye effect. I also treat laterally to this temporal line. I'm aspirating as we go. I'm using a hyperdiluted filler, so this is hyperdilute with the 1-to-1 dilution of saline, and that makes the filler settle in nicely, and it volumizes instantly, and it gives a really nice lift effect. And then let's go ahead and do a little touch more right there. I'll take the other half of that. Thanks. Meanwhile, I'm going to estimate this position of her cheekbone. So if I bisect this angle that we've created, this is the rough trajectory I want to follow. She's had a previous Voluma treatment several years back, so that's given her a nice rounding of her cheek, mid-cheek area, but I would like her to have more angulation and lift following the exact border of the bony zygoma. So this is a bony contouring technique that we're going to use. When we can make the cheek come all the way up into the temple, we're going to have the prettiest results, and we're also going to have the most maximal lift. So let's finish doing her temporal fossa here. And we can already see that the brow is starting to look more open, wide, and pretty. We're going to do 2 more injection points and give the maximum amount of volume. Are you doing okay there? A little quick pinch and a funny crackle, just like that. And I like to do a prolonged aspiration, and then I like to do a rather slow injection technique. So aspirating at least 4 to 5 seconds, and then slow injection technique. And sometimes I'll stop and aspirate a second time just to be extra sure and extra careful. I'm also going to give a touch of filler directly above the orbital bone here. Sorry, my dear. There's a small supraorbital fossa that can be filled, and the filler can then be directed to support the lateral tail of the brow. After treatment of the temples, patients will sometimes complain of soreness. That's very normal, so softer diet, some Advil for a couple days as you notice it is going to be helpful. My needle here is directly on the floor of the supraorbital fossa. I'm aspirating and I'm covering the superficial temporal artery branch, which I can feel directly under my thumb. So that's a nice improvement. We can already see a little more open and wide appearance of the upper brow. I'm going to now go right into our cheek injection. And are we doing okay?
Yeah.
Okay, good. You can always tell me if you need anything, okay?
Thank you.
Okay, good. I'm going to erase some of our pencil markings. I want to use filler to support this heaviness of the cheek and take weight off of the fold. This droopiness and jowliness will improve with this vector of lift in this direction. Always we're going to play with our skin and determine where do we want to lay this volume to give the maximum amount of support. That is critical. We can't just look at the face and decide to place volume based on anatomy. We also have to look at the physics of where the gravity is pulling and where we're going to get the most benefit from the smallest amount of filler. Every patient has a different filler budget, and I think that's very important to plan ahead and determine where you'll get the best results with the filler placement. Go ahead and make a little kissy face for me, like a moi. I can kind of see the trajectory of lift that I want to use when patients make that expression. That's a nice quick trick to show us the best vector of support here. And now 1, 2, 3, little pinch. I'm going to place filler on the zygomatic prominence right here, the apex point and the most prominent portion of the zygomatic arch. I'm also going to follow retrograde all the way up the zygoma, just like that. Perfect. And now we're going to add some additional filler. towards the upper portion of the bony zygoma. So we've treated periosteally directly on the lower border of the zygomatic bone. Now we're going to visualize the upper border of the bone. I'm actually going to come in here on the perpendicular touch and hit the bone, skive directly upwards of the bone, and give a little depot of injection point on the upper border of the zygomatic arch, just like that. And that creates this little soft rounding, and that's a point where we're on periosteal plane, and it's a safe plane. I'm also skiving directly on the bone all the way up and giving that little bolus of support, just like that. Okay, good. How are we doing so far?
Thumbs up.
Okay, good. Great. I noticed that she has one small touch of hollow here laterally. I'm going to place a little injection, 0.1 cc depot injections on all of these points. So currently we placed about approximately 1 ml. I'm going to place a total of 1.5 on each side. And then we're going to go over to her jawline. So that contouring technique gives some immediate lift. In my mind's eye, I really want to get the cheek to line up with the temple. So over time, as we can, we'll put more volume into her temple and build that all the way up as well. And now at this point, we're going to treat the lower face. So if you create 3 vectors of support, 1 stripe, 2 stripes, 3 stripes, almost like I've heard it described as the 3 Adidas stripes. These are the vectors of support where we place threads. So when we're trying to get lift and support with filler, if we place the filler in a surgical plane with surgical intent, we actually can have results that can almost mimic what we can do with threads or with surgery. I feel like with excellent filler placement with high G' products like calcium hydroxyapatite, which I'm using here, or Radius, which is one of my favorite products, I can get results that rival thread placement. And so I place initially on the angle of the mandible a bolus of 0.3 to 0.5 cc's to create a sharp angulation of the border of the mandible. And then we're going to create the posterior ramus of the mandible by allowing the needle to come up in the subcutaneous plane and doing a retrograde linear thread. This plane is safe, there's no vasculature in it. And then we're going to do the same thing along the lower border of the mandible. The 2 areas that we need to treat here are the antegonial notch and the pre-jowl sulcus. Placing volume in the pre-jowl and the post-jowl sulcus is going to give a nice, beautiful, long appearance of the jawline. 1, 2, 3. So my finger is in the antegonial notch. I'm palpating the facial artery. This is the most important part of the facial artery as it crosses from the neck and the carotid into the face. So if you are new at this, you're going to want to use a cannula. And I'm using a needle technique because of the sharp precision of it. I'm able to inject directly on periosteum, and I'm protecting that facial artery. And I do like this technique. Let's tilt your jaw out towards me just like that. I think this technique is safe to do as long as you're comfortable with your anatomy. So you can feel the notch, we can feel the little ridge of artery, and then I can push the artery out of the way with the fingertip and then inject directly behind on periosteum. My next step is going to be going subcutaneously, and I'm going to create a thread of support here so that visually the light reflex will hit this jawline in a way that looks sharp and precise. So much of what we do with fillers is light and dark shadows and placement, and we're giving that nice border definition by creating a strong, firm line. We'll also go now to the pre-jowl area, and this is where we're going to place a bolus of filler directly, like a small droplet in the pre-jowl sulcus and a small droplet at the chin itself. I think one of the most ignored and important steps of doing jawline filler is placing a bolus of filler at the mentum, just anterior to make the long, strong appearance of the jaw. So that's one of my favorite areas to inject. I will palpate and make sure there's no arterial pulsations of the submental artery crossing over the border of the mandible here. We will make sure we're directly on periosteum and give a 0.1 cc little bolus of filler, and that just gives that beautiful, long, corrected look. let's have you take a look at your face so far and see what you think of this side. So we've done 3 zones, upper, middle, and lower face, and I think that already it looks really refreshed. Take a look.
Yeah. Totally different.
Totally different, right?
Mm-hmm.
You can put your mirror down for a second. Let's show the camera here. Lean all the way forward, sit forward, and then chin down. So here we can see a little more open, wide, pretty eye. The cheek is tapered all the way up and supported. The heaviness of her jowl has improved markedly. We can see on this side jowling versus tightness. I like this vector of lift versus this heaviness here versus pulling up and down. And I also think that the eye looks more open, wide, and pretty. So that's a nice, quick result. That's going to be a half a syringe. We actually did 1 full syringe of filler for the temple, 1 for the cheek, 1 for the jawline. And that's not excessive. If we think about this distance, this is the size of a syringe. We need to have enough volume to cross this amount of territory. So that's very precise placement. Most of the time people are using a lot more than 1 syringe or half a syringe. So I think economy of use of filler is very important. All right, are we feeling okay?
Yes.
Okay, good.
I'm excited now.
Okay, I'll take a temple filler. Huh? They're pretty, right?
Small amount. It's like I've been working out like a lot.
Go grab it.
I have it right here.
Okay,
It's like I've been working out and I'm like 10 years younger.
on that side? Yes.
Yeah.
Let's keep this side.
Yeah.
Keep working out. We can see that you have a lot of upper eyelid hooding. You're definitely a surgical candidate. We can do brow threads. You can continue to add temple volume here. Literally, that was 1 syringe. You need 2 to 3 to cover this territory. But the more volume that we place in the temple, the more beautiful the upper face looks. And the face is round like a basketball. When we're young, we have like a round basketball head. And the more volume that we place laterally in the temple and the parietal area, the more we look refreshed and young. And I literally think as we age that this caving in is the beginning of the cheek falling and the beginning of the jowling setting in. So pulling the cheek up and back helps tremendously. Okay, I'll take that temple filler and then. All right, so beautiful transformation of the face. Literally this side feels heavy, downward, and tired, and this side uplifted. So pretty. We're going to do the same thing here. Go ahead and open your jaw nice and wide and close it. Good, excellent. I can see the tortuous nerve vascular bundle here of the superficial temporal artery coursing all the way up, and I can even palpate it right under my fingertips starting. I can feel the palpations in here. I'm going to have 2 areas injected, 1 vector to lift the brow upwards and another to fill the concavity over here. Both are equally important. When I'm using temple filler, I would love to use 1 syringe per side. Oftentimes patients can't do that. So you're going to use your filler judiciously and place aliquots of about 0.1 cc's in 2 to 3 locations to give the maximal lift possible. One of the most important locations is here. Supraorbital area has a small fossa, which we can hit exactly on periosteum and give a 0.1 cc bolus to support the tail of the brow. We're also going to inject a little bit up higher to support lateral brow lift. And this is kind of exactly where I'd position her for brow threads or for surgical lifting. It's important to play with the skin and pull upwards and backwards and figure out where we'd like to place filler to get the most lifted surgical results. So that's a half a syringe. We can already see nice improvement. We're going to do the full syringe. Remember, this is hyper diluted, so I want to use filler that's 1-to-1 dilution. Can I have the other half of that syringe here? As we inject, we notice the superficial temporal artery is starting to protrude and show its a little bit of angriness, a little bit of blood pressure elevation. So that helps us a little when patients get stressy. Blood pressure goes up. We're going to say take a deep breath. Let's do 3 big breaths. 3 big breaths will drop your systolic blood pressure by 5 points. That's excellent. I think the injector should also pause and take those 3 big breaths because we need that as injectors too. We just sometimes need to get in your zone. You run in a room, you start injecting, the first thing you do, you're like, go, go, go. But the first thing we need to do is stop breathe, connect ourselves with the patient center, be on the same wavelength, and then we're ready. Are we ready? Thank you. Good. And now let's clean up. And this is a really funny feeling if you've never had it done as a patient.
You can hear it too.
It sounds like a funny crackle noise. Someone told me it sounds like you're stepping on a packet of ketchup. And I think that is a really accurate analogy. I think a hyperdiluted filler in these areas is critical. These fillers absorb 1,000 times their water weight. So this is an off-label use of product, and I'm making sure that it's going to really occupy the space-occupying cavity, this empty space, well. Let's pre-hydrate it. Let's make sure it doesn't settle in lumpy, irregular areas. And using that pre-hydrated mix is one of the best ways to do that. You can do that with a 1-to-1 dilution. If we're super thin, a 2-to-1 dilution. Here I'm giving a bolus, and then I'm going to just massage, manipulate, and allow it to settle in so easily. You can't do that with straight filler. So using a dilution technique here is a good one to master. And we're going to do the same thing right back here. And if you're a student and you want to learn how to do injectables with me, you can join me on Modern Aesthetic Theory. That's my online course where I'm going to teach you how to do these fun tips and tricks, the finesse points of doing filler. I'm going to have the next syringe for the cheeks, and then we're going to use calcium hydroxyapatite to contour all the way up the cheek to improve this bony structure. So the technique of bony contouring is an important one to master. Your patient's facial anatomy may change with elasticity changes, sun changes, gravity, pregnancy, aging, fat reduction, everything. All of the skin envelope will change. The bony contours will stay usually very consistent, with the exception that, of course, bone changes with density as we age. We lose bone density. I like to use bony contouring to replace lost bone density to give that underground support so that skin will drape properly. It gives underground support without creating a filler face look. So we don't want a doughy, over-injected, overly dependent look that relies on too much gel fillers. The gel fillers are lovely for soft areas of the face, for the lips, for the under eyes, for the temples, for areas we want expansion, we want soft, beautiful volumes, but for areas where we want crisp definition, support, and lift without having an overfilled, overly jelly-looking face, we're going to use bony contouring techniques. And calcium hydroxyapatite, or Radius, is totally appropriate and one of my favorite fillers for this technique. I'm going to have you make a little kissy face, and doing so allows me to visualize the trajectory of lift that I want to have for this face. I'm going to give a little retrograde injection thread with a constantly moving needle to support a little of the mid face here. As we come around the curve of the zygoma, we've placed 2 drops of filler, 0.1 cc boluses, on the apex of the zygoma, the most important part of the cheek, the apple of the cheek. That is representative of femininity, youthfulness, vitality, health, fertility, everything. The apple is everything. We don't want to overcorrect the apple. When I look into injector audiences, all I see is big apple voluma cheeks. I love voluma, but we don't need it all in their cheeks. It shows up too much on the Academy Award stages of women with giant, over-injected mid-cheeks. So we're going to evolve our technique to have more bony contouring and support that follows the natural zygomatic arch. So we're going to give injection points supraperiosteally, avoiding the zygomatic foramen, avoiding the zygomatic vein that crosses here, and coming all the way up, following the inferior border of the zygoma. Just like that. When I look at this face now, it has some support. We've given back some of the bone structure of the 20s. As we get into the 50s and 60s and beyond, we lose mid-face bone density. Now let's do the same technique for the upper aspect of the zygoma. We're going to come in, hit periosteum, skive directly up the zygoma, and give a small aliquot of support on the upper aspect of the zygomatic bone. So this is a technique that you can use a cannula. You can perfect it with your own ideas and your own techniques. You can come directly on periosteum if you feel more comfortable to do it this way. When you're crossing, when you drop a line from the lateral canthus down, be careful of the zygomatic vein that crosses, and just be aware of where your superficial temporal artery is also going to cross. These are your important landmarks to be careful of. All right, so that technique gives lift and support. And now we're going to go ahead and work on the jawline. And here I barely used 1 ml of filler. That's enough. We don't need to put too much filler. Turning your jaw this way and showing me, go ahead and cock your jaw out towards me. Okay, good. Now like this, where you give a little angulation. Yep, just like that, and like that. Perfect. And we're going to put a small bolus at the exact ramus, at the exact angle of the mandible here, at the posterior border. This is going to be 0.3 cc's. I'm going to give 2 spots, 1 and 2. I'll take the next syringe. Thank you. I typically love to do jawline filler because it creates so much support for the lower face. Once that bolus is in place, we can then go superficially in a subcutaneous plane and create a sharp border. And this is somewhat of a visual trick because we're allowing the light reflex of filler hitting the face to create definition here. We want to give the impression that she has a strong ramus of the mandible that comes up and gives that posterior limb here. It is there, but it's hidden under a few layers of skin, a little bit of subcutaneous fat, and it's not as sharp and defined as it used to be probably when she was younger. So I'm going to give a little structure to it. We're going to find the antegonial notch, palpate the facial artery. Once that's out of the way, we're going to touch periosteum and give a bolus to pull that out. I've seen a lot of people just go ahead and give filler all along the border without doing that one maneuver. And I think that it looks much superior to add volume there because your eye can still detect volume loss and shadows when we leave that unattended. Next step is going to be a Pre-Jowl sulcus. You see my eye can detect that little shadow, and so can yours. This Pre-Jowl sulcus truly is the area where the mandibular ligament has some loss of volume around it. The bone underneath the mandibular ligament has recessed and hollowed, and the soft tissue as well. So I'm going to go under the ligament. I'm away from the facial artery. I'm going to give a slightly more than you would think, so 0.15 probably on that bolus, and that's going to help correct the downward trend of the DAO muscles that wants to pull down here, and it creates a really nice sharp angulation there. Our last step is going to be going subcutaneously and placing a small droplet of filler right at the junction of the jaw and the chin. We are palpating for submental artery, making sure there isn't any branch crossing there, and giving a little drop of filler, and now we have a very long and strong and pretty appearance of the jaw, just like that. And then lastly, do a little overview and check your work and see where can you make it better. Let's check from our front view. Because she's still a little hollow right here. I think chin projection in the future will be great. I think we can do a little touch of filler in that submental crease. So coming in subcutaneously and softening that will be nice, just like that. And now we've treated the upper border of the mandible, or the zygoma, the upper border, the lower border. Now we're going to treat this mid portion that's hollow. So one last little drop. And typically that's going to be exactly where that facial vein wants to cross, this branch of the facial vein. So we're going to come lateral to it, give a bolus of filler, and allow it to get massaged into the hollow. And I think that is going to give her really nice results. I'm going to add my last droplets here in this preauricular area because I see she has some volume in this fold, and placing filler here allows that to tent backwards. We have a little touch more left over. We'll put that last little bit there. And the preauricular area is an area that's very often undertreated. I think we completely ignore this. And remember, If we think about our fillers surgically, this is where we're going to make an opening to do a facelift. So if I have skin laxity here, I can either pull, tighten, and trim it, pull it backwards, or I can add some volume here, and that's also going to pull it backwards. And our last step will be doing some neurotoxin for the upper face and forehead. Here I'm using calcium hydroxyapatite and Radiesse, which I think is really great for collagen stimulation. Remember, this will stimulate type 1 and type 3 collagen very nicely. And that means that your skin's going to be nicer than what we started with, that's always excellent to have long-term foundation building. All right. Awesome. That was only about 100 needle sticks.
Right.
Are you okay?
Yes.
Doing all right? Perfect. Let's have you look in the mirror. You can see how that looks. We're all done with all your fillers. So that is a very beautiful,
Big lift.
really nice result. I think
Huge.
we can see amazing contours. I like the sharp lines. I like this idea of bony contouring. I like the idea that we're not fully dependent always on hyaluronic gel fillers. Using this bony contouring technique and giving volume support where we're missing volumes is the best way to have the face look lifted and relaxed and just natural. And remember, our face has a tendency to want to fall forwards as we age. So drooping of the cheek, jowling of the lower face, and all of these changes can be reversed by creating vectors of lift that go upwards and backwards and create kind of a soft and really natural looking result. All right, so now we're going to do some neurotoxin. So close your eyes tight, tight, tight. And we're noticing where her orbicularis oculi muscle clamps down and closes in on her eye. She has so much eyelid heaviness, we'd like to reverse that. Relax. We need to not look at her hair on her brow. This brow hair is way low. If we place our toxin based on her hair position, we are going to get worsening of her brow ptosis because her musculature is actually hanging low. So I really want to be feeling with my fingers where the contraction forces are happening. Go ahead and frown for me. Good, and close your eyes tight, tighter. Okay, excellent. So I'm actually going to go up high with her to avoid ptosis and heaviness. Go ahead and close your eyes tight again and relax. Good, so I'm seeing where her corrugators are pulling in. I'm staying quite superficial above her brow bone. Frown for a moment, frown. And she's someone that I'd like to undertreat. We need to maintain movement of all of her musculature. Her forehead muscles need maximum lifting ability. Good job, you're doing great. Raise your brows up high as they go. We can see this zone here is a no-fly zone. These are muscles that need to work to lift all of the brow skin out of the view. So we're only going to be treating centrally. I like to point that out to patients. This is your no-fly zone. This is a way to avoid people coming in and telling you about the lines that they still see. We want to see those lines, otherwise we'll have drooping. Raise your brows up high again, and in her case, I don't think she's going to have spiking. Her brow does want to spike a little bit, but in a good way. It lifts her lateral, it lifts the arch of her brow above her brow bone in a much better position. So I don't think she's someone who's going to have too much spiking, but of course, we always like to check you back at 2 weeks to see if we need to do any adjustments at all. Okay, let's do a little touch for your mouth downturn. Show me your bottom teeth. Excellent. These are the DAO muscles. We're going to knock out their pull, and that looks great. When I see you back next time, guess what we'd like to do?
I have no idea.
Well, let me tell you, and as an injector, you should be telling your patients when you see them back the next time, what would you like them to do? Because they will have some ideas, but you need to decide. You are crafting the beauty of their face, and I want you to think about where you can next optimize them best. In her case, where can we optimize her best? She's going to need a little more temple filler, because boy, does that look pretty, and won't it look nice when we pull her all the way up and back? She's going to need some chin projection, and I'd love to do some lips. The icing on the cake will be lips and perhaps a little hydration under the eyes. So let's not overwhelm the patient and tell them too many things, but we're going to say when we see you back, we're going to work on lower face. So I think marionettes and lips should be our next step. After that, we would do temples and eyes. Okay, so give us a plan and something to look forward to. That is human nature. It's very important to kind of plan for the patient, give something to look forward to, and make sure they understand that they have someone who is crafting their beauty plan and their aesthetic for their face. It doesn't rely on them. They're not a professional. We are. We do this every day. We can see things they can't see on their faces. So I want you to teach your patients the importance of a beauty plan, the importance of having steps to this plan, and the importance of not jumping around from injector to injector. This is our craft, and we need to show you what we envision for your face. And I don't want you having someone choose your eyes and another person choose your lips and a third person who has the cheapest price do your forehead, because then you're going to look like no one artist has put together a beautiful picture. Thanks so much for learning with me, and learn more with me. Modern Aesthetic Theory is my passion course that I teach. I'd love to have you learn with me.